Hello and welcome. So from today I'm going to start our special videos of anatomy as I said earlier. So today's topic is our breast. Okay. Now this breast presents in men and women both sexes. Okay. Now in the men the breasts are rudimentary. Okay. Or you can say it's a vestigial organ. I mean useless organ in male. But in female it is very useful. Now this is also known as mammary gland. It is also known as modified apocrine gland. In female this breast is a secondary sexual organ or reproductive organ because its growth occurs after puberty, not before puberty. Okay, and the size of the breast depends woman to woman. Okay, it's not fixed size in every woman. Okay, position. In position you have to know that just basically it presents in front of, anteriorly to the pectoralis major muscle and little bit laterally to the serratus anterior muscle. Okay, over these both muscle the position you will find the position of the breast. Now if you want to know the exact location, you have to know that in vertically it extends from second costal cartilage to sixth costal cartilage. Okay, second, third, fourth, fifth, sixth. And in horizontally it starts from the this is sternum bone. Okay, so this is the lateral border. So now from the lateral border of the sternum bone to the mid axillary line. Okay, this is the axilla, so this is the mid axillary line. Now whatever is present in the right side, same to same is present in the left side also. Okay, now each breast has 4 quadrant. Okay, quadrant means a specific area. The breast has upper lateral quadrant, upper medial quadrant, lower lateral, lower medial quadrant. Okay, now you have to know that what are the structures present behind the breast. The deep relations, or you can say bed of breast or floor of breast. It has multiple names. Okay, you can say whatever you want, it doesn't matter. Now first of all our muscle layers, as I said already, pectoralis major muscle and serratus anterior muscle. Also additional fibers of rectus abdominis upper lateral part and external abdominis upper lateral part. Okay, is a very tiny portion, only 1% to 2%. Now over the pectoralis major muscle you're going to find another layer as a protective layer known as pectoralis fascia. This fascia prevents the movement of breast and the friction in between the pectoralis major muscle and the breast glands. Okay, now the fascia acts as a protective layer. And the third of all, you're going to find over the fascia a flat small space. This space is known as retromammary space, as you can see in this photo. Due to this space or gap area, you can see the movement of the breast from upside to down, lateral to medial, and on the 360 degree. Okay, parts of the breast. Our breast has mainly 3 parts. First of all, nipple areolar complex. Second of all, body, and third of all, tail. So first of all you have to know about body because it is the main major structure in the breast, as you can see in this photo. One important thing you have to know that, as I said, and everyone knows that cell is the fundamental and the functional unit of a body. Also a nucleus is the fundamental and the functional unit of a cell. Similarly, terminal duct of lobular unit, TDLU, it is the functional and the fundamental unit of a breast. Okay, this sentence you have to remember until you die. Okay, it's very important. Now as you can see in this photo, this breast has lots of lobes. Okay, generally on an average you will find 15 to 20 lobes in one breast. But again you have to remember one thing, that the number of the lobes depends on the size of the breast. Small breast, less lobes. Bigger breast, more lobes. Simple basic calculation. Now each lobe contains lots and lots of lobules, as you can see in this photo. Each lobule contains lots and lots of alveolar units. Now this alveolar unit of the breast is totally 100% differ from the alveolar units of the lung. Okay, lungs alveoli are different, breast alveoli are different because the inner epithelium, the inside epithelium of the each alveoli made by secretory mammary epithelial cells. Now, each alveolar unit has one tube or a secretory duct. Now, all this alveolar duct merges together and forms one lactiferous duct. This one duct you can find in one lobule. Now, as I said, each lobe has lots and lots of lobule. So, in the one entire lobe, you're going to find lots and lots of lactiferous duct. Okay, and all this lactiferous duct projects towards anteriorly. Okay, and at the terminal point of this duct, it becomes a little bit dilate. Okay, dilate and acts as a storage part or tank part, because storage of the milk after delivery of one child. All these lactiferous ducts projects towards the outside. Okay, outside at the center of the areola, and this outside projection is known as nipple. Okay, now one thing you can see another photo that each lobes of the breast are protected by or covered by a thick stroma made by connective tissues. This stroma is known as Cooper's ligament, also known as suspensory ligament of Cooper's. Now, over the layer of the Cooper's ligament and inside and outside, it is filled with areolar tissue. Areolar tissue means basically fat tissues. Okay. Now, the main point is the contrition part of the body gives a outward projections in the upper lateral quadrant, which acts as a tail part of the breast, and this tail enters into the axilla via foramen of Langer, okay, or Langer's foramen. Now, the part of the tail of the breast present in the axilla is known as axillary tail of Spence. Okay. Now, these three terms you have to remember lifetime. Okay, Cooper's ligament, axillary tail of Spence, and the Langer's foramen in axilla. Okay. Now, the last part, nipple areolar complex. Nipple areolar complex is, now you know already that how nipple forms, because the outside projection of the lactiferous sinus are super condensed. Okay, super condensed area in just one small part at the center of the areola. Now, the covering skin of the nipple area is known as areola. Okay, now areola is a little bit darker than the rest of the body skin part, because this areola consists of stratified keratinized epithelium. Okay, now under layer or the below layer of the areola consists of myoepitheliocytes. Okay, this areola consists of lots and lots of sebaceous glands. Now, this outside protrusion of these sebaceous glands in the areola at the time of pregnancy is known as Montgomery's tubercle. Okay, now main thing, blood supply of the breast. Blood supply of the breast, as usual, arterial supply, venous drainage. Okay, in arterial supply, it is mainly supplied by internal thoracic artery. I mean the branches from internal thoracic artery, additional branches from axillary artery and posterior intercostal artery, because I said the breast tissues extends up to the mid axillary line. Okay, so the branches from posterior intercostal artery gives some branches to this part. Okay, same to same, venous drainage is done by internal thoracic vein mainly. Additionally, it is also drained by axillary veins and posterior intercostal veins. Simple. And in the nerve supply, it is done by 4th to 6th anterior medial intercostal nerves. Okay, the lymphatic drainage is mainly drained by axillary lymph nodes, second of all parasternal lymph nodes, and third of all supraclavicular lymph nodes. Okay, so via these lymph nodes are the lymphatics of the breast drained into ultimately the right lymphatic duct, which ultimately drains into right brachiocephalic vein. Well, I already talked about this lymphatic drainage system in my earlier videos. You can check that. Now, the function of the breast. And the function of the breast, there is only one and only function of the breast, which is feeding the milk to her babies after delivery. Okay. Next point, which is not so important, but in modern days, and the next point is not so important, but just for your knowledge purpose, the function of the breast, primarily one function, nurturing the child by feeding babies the milk, and second of all, enhancement of beauty by a surgical modification by implanting silicone extracts. Anyway, so this is all about our breast anatomy. I hope you little bit understand. So see you soon in my next special videos. Till then, bye.